Good morning. I'm Dr. Anupama Poudel from Canada. How are you all doing today? I hope everything is going fine with you, with your families and the surroundings. Talking about here, we are in a state of emergency, staying at home and working from home and taking care of my kids. And I have a toddler to look after, and she's so much handful at this moment. But in spite of all this, Dr. Prahlad, who have this YouTube channel, requested me to share some of my ideas, which I have presented recently through online platform. And I had the participants from all around the world, and it was a fruitful session. I hope this presentation will give some information to all the viewers. And talking about myself, I major in investigation of autonomic dysfunctions in various clinical conditions, mostly for the neurological cases like degenerative neurological cases. I'm here to share some of my viewpoints. Please be noted that I'm not an expert in epidemiology, nor am I a virologist. I have shared some of my ideas at the moment. I have no such novel ice-breaking ideas to share with, otherwise I am the deserving candidate for the Nobel Prize winner this time, but it's not so. I have a limited knowledge and a limited understandings on this particular subject. I hope some of my tips would be helpful to manage this pandemic at a certain level. And today I'll be talking about these topics. These are the outlines of my topic today. I'll be talking on the backgrounds of this pandemic, the latest updates on coronavirus, the importance of disinfecting. At this moment, what we can do is disinfect the surroundings, your hands, your mouth, everything, and keeping the distance, what we can do. So this is more important at this moment. And then I'll be talking about the research being done worldwide, some of the dilemmas of healthcare workers, and I'll be talking about a global challenge. And similarly, I'll be talking about some of the discussions on how we can intervene this situation and manage the situation smartly. So I'll be talking about the opportunities of this current pandemic, and finally I would like to conclude by saying some of the tips. So let's go on to the background. As we know that we are all dealing with unprecedented situation of ongoing COVID-19 pandemic. It has become a great challenge to medical fraternity and to whole humanity at this moment. So the scientists and the researchers, the bureaucrats, the government all around the world are trying to cope up with the situation, and they are working round the clock to combat the situation. But we are becoming overwhelmed with this situation. In this backdrop, we are trying to share some of our knowledge so far gained from this pandemic. And as we know that it's a new virus, so new ideas, new challenges, new opportunities, so everything is new to us. So at this moment, we don't have such novel ideas to share with you unless you find some vaccine or the medicines. Otherwise, it's like just sharing some tips and some new ideas, that's it. And so it's a novel disease, so it's a new challenge, and what we can do for now is we all are welcome to share our new ideas for the welfare of the humanity, and I'm trying to do some of the part of. So let's talk on some of the strains of coronaviruses. So altogether, it is categorized into alpha, beta, delta, and gamma coronaviruses. Alpha is coming under the animal type, which is not spread at this moment to us, and so far we know is the beta viruses, which is spread from animal to human. We already know about the SARS, which was the epidemic in 2002 and 2003. There was a fatality of 9%. MERS is the Middle East respiratory disease. It was also started in 2012 and still it's ongoing. The fatality rate is so high, 30 to 40%. And about this coronavirus, novel coronavirus, which is also named as SARS-CoV-2, It's currently the fatality rate is 21%, and since it's a pandemic ongoing, so the number changes. The common symptoms of all the coronavirus strains are fever in 88%, dry cough in 68%, and fatigue in 38%. And when we see in the current, today is the April 10th, right? So the global status of the coronavirus cases is 1.6 million, and deaths toll is 97,000 around, and the recovery is 392,000 around. So these are all the current status of the coronavirus. So now let's go on to the ongoing global research and clinical trials. There are a number of dozens of clinical trials going on all around the world, including China, Russia, France, and in USA, even in Canada. So many research going on for the cure for this disease. Some of the medications like quercetin, which is the natural pigmentation found in the fruits and vegetables. These are all the antioxidant and also anti-inflammatory drugs. Remdesivir is another promising drug, which is the antiviral drugs, which was used for this Ebola. Hydroxychloroquine is also the promising disease, which is promising medicine, which is now ongoing research going on in this. This is, as we all know, this is the anti-malarial drugs, and similarly steroids are also under clinical trial. The best thing what we can do for now is the randomized placebo-controlled trial to find the gold. Which is the gold standard of the experimental treatment. So they are ongoing, some of the research going on still, but yet to find out the real solution for it. And similarly, antibody transfusion from the recovered COVID cases is also one of the promising treatment for this disease. Now let's move on to the mechanism of destruction of coronavirus by disinfecting, because at this moment it is very important, as we don't have the cure for this disease, and what we can do is we can disinfect our hands and our surroundings. So let's see the scientific mechanism of how the destruction happens by disinfecting our hands. So let's go on to the structure of the coronavirus. It is a single-stranded RNA. This is the single-stranded RNA. It is enveloped by the lipid membrane and the membrane protein, and these are the spikes which are made by the glycoproteins. When this get contact with the soap or the disinfectant, it get ripped up, and all these things just dissolve outside, and it become dissolved, and finally we can disinfect our surroundings and our hands. So this is the mechanism by which the destruction happens, so we can reduce the spread of these viruses at this moment. So this is a very important thing. Now let's go on to the challenge of healthcare workers. I have listed some of the challenges the health workers are facing all around the world, not only in the developing or the underdeveloping countries, but also it's a great challenge to the developed country as well. You can see here in Australia, Canada, and in USA. So I have noted some of the points. There is shortage of personal protective equipment. There is no clarity on indication of its use. There is the healthcare workers are being isolated, and they are from their family, and they have the fear of a disease getting spread to their families and their communities. So this is also a big challenge for them. And the rapid expansion of workload with increasing number of suspected and confirmed cases. Because of that, they are getting overwhelmed. There is scarcity of medical facilities like ventilators, beds, etc. And there is problem in decision making in treatment protocols, medical ethics, when overwhelmed by so many cases, because as we know that we the health care workers have been taken oath for some of the medical ethics we are following. So in this situation, we are becoming biased to whom to give the ventilators and to whom not to give. So we are in dilemma situation. So this is like a very bad situation, I must say. And the healthcare workers are getting burnt out. What do you mean by burnout? It's like a physical and psychological exhaustion together with an increased risk of medical errors and unplanned absences from the staff members, and because of that they get so much of workload, and they have the hectic hours, they have hectic shift, they have no rest, and it is the human nature and human physiology that they get exhaustion. Yeah, so I have charted in pictures, so it will be helpful to all of you. Some of the dilemmas for healthcare workers during COVID-19. The first and foremost thing is problem in decision making, because in this situation, with the lack of resources, with the lack of knowledge, the healthcare workers has to work around the clock, but without having particular ideas and aim, and they are having very much conscious about making errors in medical services, and also they are becoming biased to whom to give the ventilators, to whom not to give, and in this situation how to work without PPE. So at the same time they need to show their professionalism, but at the same time they are taking their life in stake. So anyways, the decision making is one of the big problem, and there is problem in allocation of the resources, because they have limited resource, and they have to circulate the resources to the limited person and to the frontliners, and there is like the big controversy going on to whom to use, to whom not to use. So that is also the big problem. And there is a problem in balancing physical and mental health for the health workers, and in this situation they are becoming helplessness, and they got burned out, as already I have said what is burnout. So let's go on to the discussions about how the pandemic can be intervened at certain level to healthcare workers. What we can do is, as an early interventions, is that we need to have the clarity in instruction from the leaders or the staff's member, so that we can showcase our real scenarios to them, and they become active, and they will understand the situation, and they will start working. They need to have some alternating shifts and hours, so that they can take rest, and they can do the work properly in spite of all the challenges, right? So and the next thing what we can do is we can develop online platform to provide medical advice to the public to flatten the curve. This is the very most important things in order to flatten this curve, right? So another thing what we can do is we can start the online portal to recruit new graduates and retirees from healthcare sectors, like nurses, doctors, lab technicians, and all the medical graduates. Next, we can do clear policies on use of PPE, because who are actually in need, like the frontliners are in actual need of PPE, so there should have clear policies on it. And similarly, there is need of clear roles, responsibilities, and expectations of staffs involved in this. There is need of some of the incentive to be given to the frontliner staffs, by giving some increase in benefits and some insurances to them. Similarly, we can do safe clinical measures practices to them by proper protocols to handle the case safely. Now let's see some of the support what we can do for health workers at this moment. Even a small thing count a lot in this situation. Even a smile, even an empathetic talk count a lot to the lower level staffs from the upper level staffs. Yeah, so they can do some accommodation facilities to temporarily isolate from their family and reduce the spread. They can supply some basic provisions such as snacks, water, phone chargers, and toiletries. Similarly, they can encourage open discussions and peer support programs. In this situation, they need to be more empathetic than sympathetic. So let's all gather together and tackle this situation at this moment. So some of the opportunities of this pandemic I have categorized into two, like the current opportunities and the future opportunities. As we know that we got the warning situation from all around the world in the initial days to combat and prepare for this pandemic. This became possible because of the connectivity and also because of the connected challenge, and this became possible only because of the connected world, right? So as we know that the epidemic started from Wuhan. It was already 3 months back, but whoever the smart countries, they responded well and they became aware. They started preventing from then. But we can take one example from developed countries, my neighboring country USA, who did not recognize this warning situation, and Mr. Donald Trump keep on saying that this is just a flu. It's every year it is coming and it won't harm at all. It's just, and he is keeping on ignoring this situation, and now he is now facing this disaster. This is one of the opportunities he could not catch at this moment. If he would have cast this opportunity, there won't be so much disaster. Now we can see how they are dealing with the disaster here in New York. It's like a war zone now. So the current opportunity is that we should have been alarming to the public. Similarly, we can flatten the curve through physical distancing, not getting infected and not infecting others. This is also one of the opportunities at this moment, yeah, because physical distancing matters a lot at this moment. We need to learn from SARS, MERS. Some of the smart countries like Singapore and Taiwan, they are dealing smartly at this moment because they already learned from SARS and MERS, and now in this pandemic they are doing so smartly. And this is also the current opportunity, right? We would have cast that opportunity at this moment, and we would have reduced the spread of these viruses. And we can do the rapid screening and isolating the infected from the normal groups. At this moment, what is more important is using your common sense. That means we should not rely on external organizations, including WHO, because the WHO was a little bit reluctant this time to say about the pandemic and to respond to the world, right? So we don't need to rely, and this is how Taiwan did this time. The Taiwan did not rely on WHO, and we need to get prepared by ourselves locally, yeah. And for the future, as we are having opportunities of awareing the community for the future pandemic using knowledge, attitude and practice. Similarly, we can do some emergency planning in overall sectors, not only medical but from all the sectors, and making some stockage of the resources including PPE at least for 3 months. Now let's go on to the conclusion, and I would like to conclude by saying that it's a challenging situation to medical fraternity and the key decision makers in navigating and addressing the situation at this moment, because it's a pandemic, so it's everywhere, it's overwhelmed. There is scarcity of PPE, there is scarcity of the medical equipment, so it's obvious things. So lesson to be learned to combat future pandemic. And also it's a time to show our professionalism, but at the same time life in stake for healthcare workers in this pandemic. So what we can do, this is the time we need to use our own common sense and safe practice. Some of my bibliography. So finally, I would like to conclude by saying that let's flatten the curve. We are the one who is responsible, and if we all together, we can flatten the curve and maintain our distance, keep on washing hands, and reduce the spread of the viruses. This is from my veranda. That I have quoted saying that there's empty roads, but still there is a ray of hope. Thank you very much. Hope this information is a little bit informative to you all. Thank you.